And this is going to be about microbiology. And if you remember the first day or so, we talked about Koch's postulates, which basically this microbiologist Koch came up with these postulates to allow the isolation, identification of organisms in determining certain pathologies. Epi-relevant characteristics of microorganisms are: one, host specificity. Pathogens can be host specific, not always. Sometimes they're multi-host specific. Viability in the free living state, especially for bacteria. Host ranges, rates of genetic change, antigenic characteristics, response to chemotherapeutics, and morphology, chemical composition and growth requirements. I'm sure that there's a few microbiologists in this course. I am not a microbiologist, I will point that out. So if I say something truly bizarre, please forgive me and please correct me. I definitely need to know. Yeah. Pathogens of note: E. coli, normal GI flora may produce toxins encoded on plasmids. Abnormal outside the GI causes UTI, septicemia, GI disease. Klebsiella pneumoniae, found in 5% of healthy individuals within GI and respiratory tracts. It's an extremely common cause of UTIs. Pneumonia, burn infections, septicemia. Shigella, community-acquired diarrhea. Pseudomonas aeruginosa, gram-negative bacillus carried by 5% of healthy individuals, a high proportion of hospitalized patients. Lives well in inanimate objects, causes burn wound infections, sepsis, pneumonia, UTIs, cystic fibrosis patients. Strep. I think a lot of us know about strep in this course. If you've had strep throat in your life. Group B strep, neonatal meningitis, Enterococcus spp, normal GI flora, again, causes UTIs. Seen a pattern here? Wound infections, emergence of vancomycin-resistant strains. Staphylococcus aureus, carried by 40% of adults, and the nasopharynx. So of course, well, you got to wear that mask and wear it over your nose. Increased 57% in hospital patients for the skin infections, pneumonia, wound infections, enteritis. Ecology: funguses, fungi. Increase in number of immunocompromised patients. Extremely immunocompromised people are extremely high risk for fungal infections. Newly developed antifungal drugs, resistance is emerging for some. Antifungals have come a long way in the past couple decades, but like antibiotics, resistance is a concern. Limited molecular work. Common pathogenic yeasts include Candida, cystitis, vaginitis, dermatitis, systemic dissemination. Cryptococcus neoformans causes meningitis, pneumonia, and compromised hosts. Extremely hard to treat. Common opportunistic pathogenic molds, Aspergillus, SPP, necrotizing pneumonia. Definitely don't get that. Coccidioides immitis. I can't pronounce that. That's okay. you can read. So yeah, obviously yeast infections are common, Candida infections are common, both. Yeah, but there are some very serious fungal diseases out there. Parasites, obviously my favorite. Species harboring parasite, range of impacts, no harm, severe disease. Often, especially with intestinal worms, it sort of depends on how many worms there are. Very few can sort of live in symbiosis with humans and cause no ill harm. Many are obviously a huge problem. Endoparasites live inside the host and cause infections. Ectoparasites live on a host and cause infections. I think we've talked about Plasmodium already, and flatworm or filariform worms, intestinal worms. We've talked about these things. Parasitic life cycles. Number of stages varies dramatically with different parasites. They're all over the place. Number of hosts for whole cycle also varies. Direct, one host where parasite spends most of its life, and indirect where there's 2 or more hosts. Parasite usually reaches sexual maturity in its definitive host where it starts to reproduce. Intermediate host is the larval or intermediate stages in transmissible form. We've talked about viruses. We don't need to talk about this again. Yeah, we've talked about these things. Pathogens to note, RNA viruses, parainfluenza, influenza, Hep A, B, C, D, E, F, HIV. Arboviruses are really cool. So West Nile virus, Zika is another one, dengue. DNA virus, herpes simplex, varicella zoster, chickenpox, cytomegalovirus. Yeah, these are stuff we've already gone over, so going to move on.